Hello everyone, this is Dr. Padmanabha Verma, Consultant Endocrinologist, SLG Hospitals. Today I'll be talking about what are the common kidney problems that can happen in patients with diabetes. So the most common is actually if patient sugars are not controlled, then because whatever the high sugars that are there in the blood, they'll pass in the urine. So whenever there is a excess glucose, wherever there is a glucose, that will attract more bacteria to grow. So that's why the most common are the infectious complications. That infectious complications can be a simple urinary tract infection, lower urinary tract infection, that you actually feel like you are having burning sensation in the urine while passing urine. Sometimes you'll go more frequently, like when you have a sensation also, you may not control till you go to the washroom. So frequency, urgency, these are the common complications that you feel, and more frequently you have to go to the washroom. And this urinary tract infections are actually more common in diabetic patients compared to the non-diabetic patients, because as I said, this is the common reason. And second thing is the most dreaded complication is the pyelonephritis, especially the emphysematous pyelonephritis. That means the gas producing organisms actually, when they infect the kidney, then they produce the gas and they cause necrosis of the kidney. This is an emergency. You have to get treated for this with antibiotics and surgical procedure if necessary. So you should not neglect any kind of urinary complaints if you get, especially in diabetic patients. One more common asymptomatic condition is the diabetic nephropathy. That means initial stages you might be losing a lot of protein in the urine, that we can detect by checking the urinary protein levels or microalbumin levels or protein creatinine ratio. That is actually it's a early sign of diabetic nephropathy. That means your diabetes has affected your kidney. That means many times we see the creatinine levels that may not be raised in initial stages, that can be very well within the normal range. But the initial stage, many people will be losing protein in the urine. That's why you cannot just rely on the creatinine. You also need to check the protein loss in the urine, because that is the early sign. We can treat this condition with commonly available medicines to prevent the progression of this early stage to the proper diabetic kidney disease. That means whenever that creatinine start rising, then finally you end up in going for a dialysis. So at early stage, you need to identify these kidney problems and seek a professional help for the kidney issues or urinary tract infections or proteinuria. Then take a proper medications. And of course, the most common thing is, most important thing is, you have to keep your blood sugars under control. Then you can prevent all these complications. If complications happens also, early you have to detect, so that you get a proper treatment and prevent the end complications. Thank you.